to open it up for public comment.
Hi, everyone. My name is Jesse Stone. I am the Public Information Officer for the Bureau of Behavioral Health, Wellness, and Prevention. We are going to be accepting some public comments here at the beginning and at the end of this meeting. If you have any feedback related specifically to our strategic plan, we will also be accepting that at the end of Shannon's presentation. All of our public comments will be limited to 3 minutes, and if you have a comment, please state your name for the record before giving one. If you have a comment, please go ahead and either raise your hand or unmute. Okay, one last chance. Does anyone have any public comments? Okay, I'm going to go ahead and take that as an opportunity for us to go ahead and close out the first public comment. You will get another opportunity at the end of the meeting if you think of anything. And with that, I'm going to go ahead and pass it back to Shannon to do a quick presentation about this strategic plan. And again, we will be doing a quick Q&A at the end of this session.
Thank you very much, Jesse. Thank you, Tiara, for sharing your screen. I appreciate it. Okay, well, good afternoon, everybody. As I mentioned, my name is Shannon Bennett. I'm the Bureau Chief for the Bureau of Behavioral Health, Wellness, and Prevention here within the Division of Public and Behavioral Health. I'm joined today by a very large amount of our team here, so we hope to be able to answer some questions as we go along. After I get through, we have about 40 slides or so. After we get through the presentation, we'll open it up, like Jesse said, and for some questions and answer period. So we will go ahead and get started. So just a little bit about the division. Our mission is to protect, promote, and improve the physical and behavioral health and safety of all the people in Nevada, equitably and regardless of circumstances, so they can live their safest, longest, healthiest, and happiest life. Our vision is a Nevada where preventable health and safety issues no longer impact the opportunity for all people to live in the best possible health. And our purpose is to make everyone's life healthier, happier, longer, and safer. Go ahead and go to the next slide, Tiara. Thank you. So we're going to talk a little bit today about how we got here, our methodology with the strategic plan, the needs assessment and the findings, and then really delving into the strategies in each area. This bureau, as many of you know, covers a lot of topic area from problem gambling to the crisis response system to some core community mental health programs and all of our substance use programs. So it's broken up in that way, and we'll go through each one of those strategies. And then how we're envisioning using this moving forward. Go ahead and go to the next slide. The next slide, Tiara, thank you. So this strategic plan was put together with a vendor called Altarum. They did a very comprehensive approach across the state of Nevada. They did a comprehensive data analysis of all of the various data sources that we have available to us. In addition, they spoke with 16 key informants across the state that are professionals in the field somewhere. Some of them may have been you, somewhere across the state, and approximately 60 people that are in or have been in the behavioral health system in the state of Nevada. So these are people with lived experience. You're going to see their quotes throughout the presentation today. These quotes mean the world to us, and they are our driving force behind this strategic plan. And then, like I mentioned, there was a comprehensive data analysis. You're going to see some of those data in the strategic plan itself, and a lot more went into the behind the scenes of creating some of these strategies. The goal of everything was to be a direct reflection of the needs of Nevadans as it relates to community behavioral health services and the system that surrounds that. Go ahead and go to the next slide. So just a little bit about the state of Nevada. We are a little over 3 million people, primarily white and Hispanic individuals that are living here. Median household income is just over $76,000 a year. And 12% of people in Nevada live in poverty. Go to the next slide. So if we had to boil down the strategic plan into a nutshell, it would be this slide right here. In all of the areas across the Bureau's touch points in all of the various programs, we heard these things: that we have a problem with stigma and it is preventing people from accessing care or staying in care. Peers are the key to a greater and stronger behavioral health system in Nevada. Our CCBHCs are a cornerstone to many of our programs, and we need support accessing care across the state. Go ahead and go to the next slide. So there's some sections of the strategic plan that are not specifically related to a program area within the Bureau, but just something kind of cross-cutting across, like workforce, for instance. So no surprise to anyone in the room, I am certain workforce, behavioral health workforce is a problem. It has been expressed that the shortage is driven by burnout, low salaries, and an uneven distribution of providers. This is really a focus in rural and frontier Nevada. And you'll see a quote there at the bottom. You're going to see this throughout the presentation. Wages have more or less remained stagnant for a lot of professionals. Go ahead and go to the next slide. I wanted to pull this out in the presentation because I think it's really compelling. From 2018 to 2024, there was a 26% drop in mental health providers across the state of Nevada. You know, I think we all realize that that was over the pandemic years, and I think it just calls into question what's going on in the state that's making this happen, and what can we do to be responsive to it. One of the big things that has been a large discussion, and you're going to see this throughout the strategic plan, is telehealth. How can we push telehealth, and how can we improve access to telehealth services across the state? Go ahead and go to the next slide. So our workforce strategies include expanding training opportunities to our BSeen certified providers for dual diagnosis. The strategic plan talks a lot about our certifications that we currently have in place, and it also talks about what certifications we would like to put in place as we move forward into the future. And it really talks about spending a lot of effort making sure those certified providers have the resources they need training wise to do the work that they need to do in their communities. They're really the cornerstone of our providers across the community. And then here you'll see telehealth coming up as a workforce extender. So we're looking at different strategies to be able to promote telehealth as many places as possible. Go to the next slide. And here we have social determinants of health. So community members talked a lot about how these underlying factors are impacting their ability to stay in treatment. Everything from housing stability, lots of transportation challenges here across the state, specifically in rural and frontier Nevada, and just overall access to behavioral health care. Community, oh, can you go back to that one, Tiara? Thank you. Community members talked a lot about this really pivotal moment in time of stability. And if they get knocked off that track, that they can fall right back into using a substance or back into a crisis. And they talked a lot about the importance of being able to have those supports, whether it be childcare or housing, recovery housing, transitional housing, to help them in their recovery longer term. And like if those services aren't available to them, that is very easy for them to fall back into their previous patterns. So you'll see that here. One of the biggest perpetuators of my addiction was being homeless. It was a vicious cycle of drugs and being homeless. And that was a direct quote from a community member. And just a graph here to talk about, to show the increase in number of individuals that are experiencing homelessness in Nevada from 2019 to 2023. Go ahead and go to the next slide. So some of the key strategies here to expand and stabilize foundational supports. So kind of those things that I talked about before. Lots of housing support discussions throughout the strategic plan. Transportation is a big thing, especially in rural and frontier Nevada. A lot of discussion about supported employment pathways when we're in recovery. And coordination across different community organizations to ensure that those activities are being supported. And then integrate social determinants of health into aforementioned care coordination, to just be thoughtful about those things and to be culturally responsive. Go ahead and go to the next slide. Youth and special populations, a lot of discussion about these populations throughout. So our vendor suggested pulling them out and making sure that they had a special spot to live in the strategic plan. So the strategic plan talks a lot about youth and a lot about youth in schools, and the supports around youth in schools and their parents to ensure that the families are well supported to make sure that the kiddo can be served the best way possible and is connected to all the things that they need. So community members expressed a need for early support services for youth. Lots of discussion about the role of parents and supporting parents. Schools and accessible behavioral health services. Community members also talked about the isolation of groups, including veterans or LGBTQIA+, individuals and the elderly, in ensuring that they have more tailored support for some of those specific populations. And then, of course, the incarcerated individuals were also called out here and ensuring that they had appropriate support for behavioral health care. So just a couple things, couple quotes from community members here. The mindset of parents, they don't want to admit the fact that their child is struggling. And then another one, especially our male youth, they wind up incarcerated instead of being in treatment where they belong. So those are two quotes from community members across the state from the focus groups. Go ahead and go to the next slide. So some of the strategies here to increase access to timely and ongoing behavioral health services. Expanding school and community-based services for youth, utilizing telehealth to improve access to priority populations. So you're seeing these trends throughout the strategic plan already. Sequential intercept model, supporting diversion and deflection. Strengthen family, peer, and community-led support systems. So empowering caregivers and helping the caregivers know how best to care for the individual in their life that's struggling. And to be inclusive of peer and community support networks, and promoting intergenerational and cross-cultural learning opportunities. Go ahead and go to the next slide. Okay, so now we're going to start getting into some of our more program area specific topic focus areas. First one being problem gambling. Community members and experts talked a lot about that this is a very highly stigmatized topic area and that the public just simply doesn't understand it or doesn't know enough about it. So the community also discussed that there is access to recovery supports through the Gamblers Anonymous and other helplines. And I thought this was a very good quote here. There's a great, long, and storied practice of hiding it from a key informant, which I think is problem gambling in a nutshell, but it absolutely is connected to everything else that we do, especially in our state. Go ahead and go to the next slide. So a couple strategies here to strengthen screening and treatment capacity for problem gambling. One of the things that we really leaned into with this particular strategy is leveraging the community of providers that we already have and ensuring that problem gambling is called out in those communities and that they are being taught the resources and provided with resources to ensure that the providers know how to screen for those things and know how to get them help if they need it. And then a lot more about public awareness. So public awareness and early prevention of gambling addiction. We know that awareness is a problem. That was apparent in this strategic plan as well as some other work that we've done in the community in our problem gambling program, and that there needs to be education on the signs and the risks of gambling addiction and how it interacts with other behavioral health conditions. Go ahead and go to the next slide, Tiara. Okay, substance use disorder. So community members discussed a lot about the increased use of methamphetamines and stigma, limited access to prevention, treatment, and recovery services. this is where we start to really see the stigma pop up here too, as we did in problem gambling. So community members stressed that limited public understanding and misconceptions actively hindered timely help seeking. And we see this as a trend throughout the strategic plan. Barriers were identified in accessing substance use treatment, including limited service availability, high costs, and other challenges. A request, and we see this throughout too, a request for stronger integration between physical and behavioral health. You're going to see this pop up again in the mental health, and they really want like a holistic, whole person care. Integration with primary care is really how we're interpreting that, making sure that other providers, not just substance use providers or mental health providers, know how to screen for some of these things and know how to get the people help. Because they maybe have the first access point in numerous places. And this is one of our favorite quotes from the strategic plan because I think it's very, very meaningful and very impactful for us. I felt judged by the ER doctor. After that, I didn't want to go back, even when I knew I needed help, from a community member from the focus groups. I included this data just a little bit about the number of people that are struggling with substance use. So 35 Nevadans per 100,000 died from substance use, and then 2,219 per 100,000 visited an emergency department for substance-related dependence. And then we go back to the quote that we just heard from an emergency department. So I think there's some striking calls to action there for sure. Go ahead and go to the next slide. So getting into some of our strategies to reduce stigma and strengthen community engagement for people with substance use disorder. Lots of recommendations for person first language and education initiatives, healthcare provider training and for peers to be integrated into recovery services, a campaign to talk about increased education awareness and access to overdose prevention activities such as naloxone or test strips. Access and affordability of substance use services. We really focused here on increased access to MOUD and expanding deflection pathways. Here's telehealth popping up again. A desire for some EMS partnerships and mobile partnerships to ensure that treatment is getting out to the communities that need it the most and getting it as early as possible. And then here we have the integrating the substance use treatment into primary care and non-specialty settings for that more of that holistic care. And then here we have to enhance quality and integration for care for substance use disorders. Implementing standardized quality measurement and improvement systems, strengthen care coordination mechanisms, the sequential intercept model, and to track service engagement and recovery outcomes as well. Go ahead and go to the next slide. Okay, so moving into mental health. So you're going to hear very similar type things as we talk about mental health too. But community members shared about the ongoing impact of stigma with mental health for accessing mental health services, including provider shortages and geographic barriers. Community members wanted more comprehensive and personalized mental health care that could address complex and overlapping issues and identified gaps between current available services to Nevadans and the support that individuals and their families actually need. The quote that we shared here was, depression and anxiety are everywhere. It's like people are barely hanging on, but no one talks about it. Go ahead and go to the next slide. Some data here about the percentage of Nevadans reporting having a mental illness at 23%, and then 20% receiving a mental health service. Go ahead and go to the next slide. So some more access issues here, increased access to timely and ongoing mental health services, community-based prevention and early intervention. There was a big desire for early intervention on the mental health side, trying to catch people as early as possible. Again, we see telehealth popping up here for ways to be able to strengthen our access in especially rural and frontier areas. There's a big desire to get providers to work more closely together and to coordinate. We see here, here in a few slides, also a lot about wraparound care and the lack of wraparound care that we provide here in Nevada. So I think we start to see some of that here. But a discussion about transportation supports and the workforce again, coming up in the mental health topics. And then stigma, of course, again, this is a strategy that we're going to see throughout, but stigma and strengthening community understanding of mental health. Recommendation to launch a statewide mental health literacy campaign to normalize help seeking and reduce stigma through community partnerships. Go ahead and go to the next slide. And here we have more of that integrated, holistic, and person-centered models of care. This one talks a lot about the wraparound support, like we mentioned a few minutes ago, including housing, employment, peer supports, and case management. Training and technical assistance to promote trauma-informed and person-centered behavioral health care models, and peers as a part of mental health teams across the state. So we see peers pop up everywhere. Go ahead and go to the next slide. All right, crisis response. Crisis response really talked a lot about the support, the need for and continued and enhanced support of our law enforcement partners. The community talked a lot about the emotional weight of suicide and preferred a response from mental health professionals rather than law enforcement. Community members talked about a wide range of experiences when accessing the crisis services, including delayed care, poor awareness of available resources, and a lack of coordinated and community-informed crisis support. Experts also noted about the unclear responsibilities and limited follow-up care after a crisis to prevent individuals and families from receiving the support needed to reduce repeat incidents. So a lot about that follow-up care. And then the quote here, even our local law enforcement, they would rather that a therapist or somebody was called that can actually handle this situation, from a community member. Okay. A little bit of data here, 888 per 100,000 Nevadans reported thoughts of suicide, 156 per 100,000 Nevadans attempted suicide, and 20 per 100,000 Nevadans died by suicide in 2023. Go ahead and go to the next slide. So regarding our strategies here to expand access, again, more access to crisis response services across communities, lots of discussion about mobile crisis teams, enhance alternative services for people with suicidal ideation, trying to keep them out of the emergency departments, or if they're ending up in the emergency departments, that the emergency departments are taught how to handle that. Strengthen the post-crisis continuity of care and wraparound supports. So we had a lot of discussion in this topic about like the cliff after someone is released from the emergency department or a crisis stabilization center or whatever that may be, to ensure that they're supported so it doesn't happen again. Go ahead and go to the next slide. To improve crisis system collaboration, trainings, and public awareness. We did do a survey, and I can't remember the date off the top of my head, but Jesse can share it, I'm sure, later. We have a lot of work to do still just in, awareness about 988, because I think there's only a smaller percentage of the state that's aware of what 988 is, things like that. Definitely need to be able to support our law enforcement and our first responders, and that's where a lot of the focus is here in these strategies, is all about is strengthening our relationships with law enforcement. Increase community awareness of crisis services, like I talked about, and through outreach and cross-sector collaboration to improve coordinated responses. And that's a big part of the crisis response system. And go ahead and go to the next slide. Okay, data infrastructure. So we really appreciated this being called out, but this came up in numerous places. So our vendor partner suggested that we pull it out and make it its own group of strategies. It's all about data. And I think that we all know, all of us who work in these fields in behavioral health know that data, we struggle with data in behavioral health, but it's important to call it out to make sure that we have strategies to be able to increase that and enhance that moving forward, right? So that's really what this is here for. We want to start having some really targeted conversations about what data do we not have that we should have, and that kind of thing. So experts noted that fragmented data systems, access barriers, and limited capacity limit the use of data in guiding program development, and we feel that 100% here. So the quote here says, "I think that a lot of the data is available, but it's not condensed into a single places, 100%. And go ahead and go to the next slide. So strategies here to improve the use of data and strengthen local behavioral health infrastructure. So standardized behavioral health data collection and reporting across different systems, promote cross-agency and provider partnerships to improve data access and reduce duplication, training and technical assistance to help providers to interpret and apply data to improve care, because that's the most important part, right? Go ahead and go to the next slide. Okay, so on the data topic, while I'm still on that, as I start switching into what we're going to do with all of this moving forward, right now we are establishing baselines. So if you have reviewed the strategic plan, or when you do, keep an eye out for the indicators, because every one of these strategies has indicators, and we are establishing baselines right now. And we're probably going to be doing that for a good 6 months or so. It's going to take us a little while, and frankly, some of the stuff we're going to have to build, because we don't have a way to collect it right now, and that's going to be a longer term conversation. So that's really where we're at this moment in time. We are going to use all that data to evaluate our strategic plan every year for the next 5 years. This one goes through 2030. We have released some RFAs, and we will do more in the future as we have funding to do so that line up with everything that you just heard in the strategic plan. And as we've seen and as we're experiencing in funding right now, there's a lot of changes going on. There's a lot of things going on at the federal level that's impacting us and our ability to move things forward. We really are going to use what the community members told us, what Nevadans told us, to make sure we're focusing there as the most important things to spend the dollars on that we receive in the block grants and so on and so forth. And go ahead and go to the next slide. So it's on the website now because we have access to our website finally. It was distributed out on the listserv, I think with an invitation for today's meeting as well. And it's available. If you need it emailed to you, just holler. We'll be happy to send it to you. Go to the next slide. And then that's our contact information, but I'll kick it over to Jesse to help facilitate some Q&A if we want to do that.
You asked for.
Yeah, thanks everyone for listening in. I know that was a little bit of a longer presentation, so I appreciate your patience. If you guys have any questions, I think the easiest and fastest way to do that would just be to go ahead and submit them through the chat box right here. And then we'll go ahead and answer them one by one. So I think we can go ahead and give everyone a few minutes here to submit any questions through chat.
Jesse, do you want to use the raise hand function for anybody that's logged into the Teams meeting to ask questions?
How many listening sessions were done and how many SMEs were from each county? Shannon, do you want to talk about that one?
Sure. Yeah, it talks a little bit about this in the strategic plan, like it breaks it down, the type of people that we talked to for key informants. There were 16 key informant interviews. There were 5 focus groups. I'm trying to remember. Elko, Pahrump, Vegas, Carson, and 2 in Reno. And they were all held at provider offices that had people in, like, that had either previous experience or were currently in some kind of program within the behavioral health system in Nevada. There was about 60 people in the focus groups across the state in total.
I think another nice thing to note there too is that I think we used a similar process for the key informants as well. They were all selected with a particular attention towards geographic diversity as well as professional diversity. And if you guys are not able to chat for any other reason, feel free to go ahead and raise your hand or unmute or anything like that. Maybe I missed this, but I feel like there's a very low emphasis placed on substance use prevention. In all my discussion across the state, the board I sit on, and people I work with, STD prevention is the number one thing they bring out, followed by mental health services and transportation. Do you want to tackle that one, Stephanie or Shannon?
I'm happy to say a couple things, and then I'm sure Steph has a few things that she wants to say too. Yeah, I think the big piece that came out here was the support in schools. There is a huge youth component to the strategic plan. And youth support in schools early and parental support as well was what we really heard in the strategic plan. So I think that would be where our focus is at this point in time as it relates to this. As far as why, I'm not sure why it didn't come up necessarily in the focus groups. I'm sure it did. It just came up in those ways. It came up in as it relates to programming in schools, catching it early, and for parents. Steph, I'm sure you have some other thoughts.
Yeah, this is Stephanie Cook. I was gonna say the same thing, Shannon. I think when we heard and saw a lot of the information related to the youth in schools, and almost at that intervention point, is where we heard and saw some of that need as it relates to substance use prevention. I think prevention and intervention are very similar topics when we hear from community members as what the needs are. You know, we heard a lot of by the time it's become a problem, I don't know where to go to get resources. And so we heard some of that in those spaces as it related to substance use prevention.
Next one is, can you please share the link to join the listserv? I can absolutely do that, and then you can also just email me, and I can certainly do that, and I can certainly add you manually as well. Our next question is, you speak about professional diversity, but how was race, ethnicity, gender, housing status accounted for? Why did Reno get 2 listening sessions but not the other counties? Shannon, you want to tackle that one?
Sure. I'm just reading here, make sure I get it all. We offered the focus groups in Spanish. So that was one way that we accounted for that. And I mean, it was open to everybody. We had a hard time recruiting in a way that wasn't tied to a provider's office. So we worked with specific providers, some of which had better turnouts than others, which is why there was 2 in Reno. They had a very large turnout in Reno that was tied back to that provider. So we didn't turn them away. We just spoke with them. But I mean, it's important to note that we heard from Pahrump and from Las Vegas as well for focus groups.
Right. And then our next question is, now that the prevention coalitions are tasked with only, how do you see prevention working along with treatment and recovery, or do you? Stephanie, do you want to handle that one?
Yeah, this is Stephanie. Throughout the whole strategic plan process, and as Shannon kind of went through all the different areas, we heard throughout that the continuum of care is broken, right? Like, so if we have a need for somebody, they're only maybe partially getting their needs met, and there's no, you know, it's hard for that continuum to be complete in a lot of these cases. So as we look at, I oversee the substance use program, so I'm speaking to the substance use question as it relates to prevention, treatment, and recovery, we know that that continuum is not linear. It's really a circular. And so, you know, we are constantly working on programs, and honestly, the strategic plan kind of helps reinforce all those things that we've been working on to really holistically treat folks and support people in all areas of their life, because we know it's not just a destination. It's really a process of how someone gets to their healthy state of being. So we do focus our efforts, and we'll continue to do that across the continuum with all of our various partners. So that is, and as you saw, and if you've read the strategic plan, that is, you know, a key piece of not just the substance use pieces, but the other priority areas as well.
Great, thank you so much. Our next question was asking to revisit what percent of Nevadans have mental health issues and what percentage received treatment. And Shannon went ahead and reposted that graphic, noting that 23% of Nevadans reported having any mental illness, with 20% of Nevadans receiving mental health services. Going on to our next question, this is a robust plan over 5 years. A lot of these potentially could be policy changes, with the session 2 years away. How will that look as the plan moves forward? As well, the indicators are all data-based, focused with the decrease in funding. How will this be captured? Shannon, do you want to talk about some of our plans to evaluate this plan over the next 5 years, as well as our ability to kind of update that plan based on any huge policy changes?
Absolutely. Yeah. So with any strategic plan, things change when they cover, you know, more than the moment that they're being created in. So we plan for that to the best that we are able to. We are planning to evaluate the plan every year for the next 5 years, and and are working on being able to do so already. So anything that were to change, we will talk about that when we get to our final report on the strategic plan. That would be the goal, is to talk about that, how that impacted things, and be able to keep the plan fluid, if you will, in that situation. So I think that that's kind of the way that we're thinking about that. We find it to be really important. We're really pushing ourselves to move into to be data driven and to move into data driven programming. So regardless of where we're at with funding, that is how we are going to be thinking about those things. If we can show that the decrease in funding is negatively impacting things, then, I mean, that's not a great outcome, but it's a great data point to be able to speak to. So that is our goal. And some of the things that like I said, I would really encourage you guys to take a peek at the indicators in the strategic plan, because some of the data that we're hoping to be able to get into is really robust, and I think will be really meaningful for the state.
Thanks, Shannon. We had a second follow-up question about health equity. Outside of offering a listening session in Spanish, I'm still very curious how health equity was addressed and accounted for.
We do have the social determinants of health in strategies in the strategic plan. I think that would be one of the areas. Also, we did a comprehensive data analysis as we were working through our needs assessment for this strategic plan. I will say that we can only talk to the people that are willing to come and talk to us. So we worked through a couple different strategies to be able to host focus groups. And the one that worked the best was working with providers, and those providers have relationships with humans, and those humans are then willing to come to the focus groups. And that's the way that we were able to get this accomplished in that way. So whoever showed up was the folks that we were able to speak to in that situation.
Thanks, Sharon. I think also, I don't know if we mentioned this, but all of our listening session participants were also, when we say community member, we're referring to people with lived experience who have actually kind of gone through the behavioral health system in Nevada in one way or another. Our next question is asking about who will be responsible for the accreditation of the BSEAN certifications, and what professionals will that, or organizations will that cover? I don't know if Fran is on our meeting today. I think she is. But do you want to kind of talk about our BC sort of certifications and what that all covers?
Thanks. Hi, everyone. My name is Fran Maldonado. I oversee BSEEN or Behavioral Health Certifications for Excellence in Nevada. We currently are only certifying substance use and detox technicians, but as you can see or hear, we are going to be adding a lot more to our program. So we're very, very excited to be able to be certifying anything from mobile crisis to mental health to for later in the day. I'm forgetting all my words. But so we're very excited to be doing that. What professionals will that cover? Organizations. We are going to be, again, partnering with CASAT to offer trainings to CCBs, offer at no cost to provider trainings to our substance use providers and our mental health providers. So once we get the ball rolling on that, we'll be able to share through the listserv and in talks with our providers on the new processes of certifications.
And I would just add a plug in there too. We do have regulations that we're promulgating right now. We have been certifying the substance use providers for a really long time, and that system works really well. Our certification is required for Medicaid reimbursement, and like I said, that's a marriage that works really nice, and we've shown success there in years past. Now we are moving into, as Fran indicated, opening up that certification to certify a few other types of providers, as she talked about, CCBHCs, mobile crisis stabilization centers, and first episode psychosis programs and assertive community treatment are the ones that we're focused on right now. We just have a draft of regulations that we're working through right now. We're going to be getting that over to LCB for drafting, and we'll be opening that up for public workshop. But lots of opportunity to engage. But like Fran said, we're really focused in on providing our providers with the right amount of tools and resources to be able to do their jobs well. And that's what Fran was talking about with all the trainings and all of that type of thing.
Great, thank you so much. The next question is asking if the term behavioral health providers also includes substance use or just prevention providers.
I think I'd have to have more, I don't know, Steph, go ahead.
I was just going to say, kind of in general, when we say behavioral health, we mean like co-occurring, right? So substance use and mental health providers. And so I think if that's the question, then yes, it includes both substance use and mental health providers that we touch in our sphere of influence here.
Okay, perfect. Lori noted that certain populations have less access to providers. And then the next question was asking if we could tell where the listening sessions were held in each community. The strategic plan itself mentions that there was a focus group in Carson City, in Elko, in Pahrump, 2 in Reno, and then 1 in Las Vegas. But I believe this question is asking for more detail than that. Shannon, do you want to talk about that a little bit more?
Yeah, we want to protect our community members' identity and information. So any further information than what Jesse already provided will remain confidential.
Thanks, Shannon. Would certified prevention specialists be considered a behavioral health provider? Stephanie, do you want to weigh in on that one again?
Perhaps we need more context to the question. I think if it's relating to BSEEN certifications, as Fran was talking about, I hate to answer without, I guess, more information. Wendy, do you want to unmute and ask your question with more context?
Yeah, it's just hey, Stephanie. Yeah, thank you. I'm just trying to, when we talk about behavioral health, we, always include prevention, especially as we're talking about this wraparound, holistic piece of care. So just trying to see where, as prevention coalitions, like get an idea where we land in all of this. And as we're really, the state is really supporting and lifting that CPS, that Certified Prevention Specialist, wondering just where that can come into play. And I get that that's not an answer you can put out there right now, but I'd love to have those conversations to see what that looks like.
Yeah, I think as it relates to our strategic plan, like this plan is to outline what efforts that we need to focus our dollars on to help support in our communities. So as we mentioned earlier, I think, substance use prevention, treatment, and recovery, if we're just talking the substance use side, is all kind of incorporated in all these various strategies as Shannon outlined. This PowerPoint did not have all the indicators listed, but Shannon did mention those. They are listed in the actual plan. So as we chip away at these things, we know that we cannot do everything in this plan that's going to happen this, year one, but we do have goals that we want to start chipping away at all these various things. So we know that this plan may not specifically call out various, professions or programs or activities. And that's kind of our job as the Bureau to kind of manage all of our different grants and state general funds to then, place everybody in. So we ensure we're funding all of the things to meet our goals in our plan. So I think some of your questions may be more granular to our actual funding sources, but as we look at the strategic plan as a whole, we know that we've got to chip away at these various things, and then we've got plans in place or ideas and activities that we need to start chipping away at. So hopefully that's helpful in answering your question.
A little bit, but I appreciate it. Thanks.
Thanks, Stephanie. Thanks, Wendy. The next question is asking if there were a variety of treatment, social services, community-based organizations in the focus group locations, or are we just talking treatment providers? I think we can say, without compromising too much, that we specifically selected the places that we did with the intention of the folks that they were able to help us recruit having experience in multiple different subject areas. So not just, for example, having substance use treatment. So there were certainly a variety of different types of organizations that hosted these focus groups. Shannon, do you want to add anything that I might have missed there, or do you think I covered it?
Well, I think there's an important clarification to make, and that is that we didn't talk to providers in the focus groups. We talked to people, Nevadans, that are community members that have been in or are in the behavioral health system seeking treatment or utilizing services some way. And like Jesse said, there were various types of organizations that hosted those focus groups for us. We also then did key informant interviews. So two separate things, both part of the needs assessment, key informant interviews. And that is where we talked to the professionals in our communities. There were 16 of them that informed our strategies in those ways, but different. It would be a different type of conversation talking to a behavioral health professional, like a provider. That would be when we talk to providers, or somebody at the university, or somebody like that. In all of this, you can see all of this in the strategic plan. It talks about, it doesn't list them by name, but it talks about the type of organization that they represented and what region of the state they represented to.
Thanks, Sharon. Kanaya also noted that in page 8 of the strategic plan, there's a quick overview of the BSEEN certifications, what they've been covering, and then what they're going to be covering in the future. Sherilyn also asked, when it comes to peers, we need to focus on second chance workplaces as we are moving to Medicaid billing, which puts a barrier on our peers to work in some organization. We haven't changed the language. Is this something you are working on already? Shannon, do you want to handle that one, or do you need a little more clarification on it?
Yeah, no, I think what she's talking about is there's certain things on background checks that show up that prohibit peers from being Medicaid reimbursable. Unfortunately, we have been talking to Medicaid about that. Steph, feel free to jump in here, but Medicaid basically says it's the CMS problem, not a Nevada Medicaid problem. So what we're really focused on doing now and moving into the future is developing like funding maps. So we have these programs. We work really closely with Medicaid. We know that Medicaid can pay for some things, and we know that we can pay for other things, and that really comes together to create a whole program. This is one of those situations. So there are going to be opportunities for us to pay for peers as Medicaid comes in to pay for peers in the new way that they will be, because those peers would be ineligible to receive Medicaid reimbursement. Things like that, I think, is part of that discussion. Steph, am I missing things there?
This is Stephanie. I was just going to add on to a little bit of that, Shannon. There's a lot of synergy in this space, not just in Nevada, but across the nation. So we are involved in various national conversations in this space. We've got teams of folks that are looking at just recovery support services. We do interact a lot with Medicaid. There's a lot of things that we understand more in depth that Medicaid does not. And so we are working very closely with them. And then they've obviously got, the billing model outlined on their state plan side. So we do work across various sectors. We do know that there's lots of work happening in this space. So happy to be at the table if anyone wants to include us on any conversations in this space. We do understand it's a gap, and we're trying, as Shannon mentioned, we're trying to build models that will work for situations like this, because we do know it's a CMS issue is what it comes down to. And so trying to ensure we have models in place to support these services is important to us. So happy to be in those conversations if that's helpful.
Thanks, guys. Sherilyn, does that answer your question?
Yes, thank you so much.
Thank you. Wendy also wanted to know, looking at CHWs as behavioral health professionals, as they are currently a key piece of behavioral and mental health teams, hoping CHWs will be included, particularly with the wraparound supports and interventions. Thank you very much for that feedback. Shannon, do you want to add anything or respond to that?
I would just say that we agreed. We are aware CHWs fill some of that need as well. And there's a lot of folks that are dual certified too. So yeah, we completely agree.
Thank you. I think we're through all of our questions in the chat. Is there anyone who's not able to chat for whatever reason that has any final feedback, any questions, anything like that? Okay, great. I'm going to go ahead and put my contact information here again. Oh, okay, we got one more actually. Given the plan has so many goals, is there a strategy for funding allocation each year?
That's a good question. I will try to tackle that. So a couple things. One, this bureau oversees the mental health block grant, substance use block grant, SOAR, 988 fees, other things that are a little smaller, but those are the big ones. So each of those has its ability, like not everything can be, go to each grant, right? Not everything touches everything. So I would say that our strategy would be to make sure that the appropriate funding source is being used for the appropriate strategy. There's some strategies that are already rolling, very, very much so already rolling. And they're like our low-hanging fruit. So you'll see, I think we're working on a lot of that stuff now, but then there's bigger stuff that's like a longer term thing that's going to take us a little bit longer to chew on and figure out how exactly to move forward with it. So this year, the needs assessment had just been done when we released our RFAs. So I would imagine in the future, we will have specific projects that we are wanting to fund with very specific criteria. It'll be less of a RFA that has, so much flexibility in it. As we start to develop some of these programs that are as they become more developed and we have a very specific direction that we're going in. The other thing that I will just say too, kind of piggybacking off of what Stephanie and I were talking about a few minutes ago, we work hand in hand with Medicaid almost every day about a lot of this stuff. A lot of the folks on the call today are providers that we have transitioned to Medicaid or are transitioning to Medicaid or will transition to Medicaid. So I think that's also driving some of our allocation too, because we may need to pay for something right now, but we won't need to pay for it in a year or so. And that increases flexibility and opportunities in the block grants or in the grants for us to take on more innovative programs that are outlined in the strategic plan. So I think there's some fluidity there. But it's a great question. I appreciate it. Steph, was there anything you wanted to add to that?
Yeah, this is Stephanie. I wanted to add a couple pieces that I think maybe for those that don't understand us and are maybe from the outside looking in. A lot of the strategies that were listed, and you'll see in the strategic plan in more detail, you know, a lot of this falls on like the state. So we're looking at like a statewide stigma campaign, right? So we understand there's this big stigma out there, and we want to tackle it at the state level with marketing that you know, that is standard and really drives all the way up to the top, so we can really get you know, a sense of reach out in our communities as it relates to stigma. So I think when we're looking at funding allocations, two things I'll say is, one thing is not everything in the strategic plan costs money. I think a lot of it's relationship building, it's connecting it, it's linking people and systems together. A lot of this system work doesn't cost money as it relates to us shipping that money out the door. It's a lot of internal stuff that we have to do. So there's not always money attached to everything in the plan. And I think the second thing I'll say is a lot of this falls on us as the state to really kind of work to get these things figured out. And then, you know, asking, as Shannon was talking about, asking for then very targeted approaches to specific projects to meet the needs that are identified. So it's a different approach if you're used to working with us. It's different from our last strategic plan prior to COVID, as you know, as we know that funding is limited or restrictive in certain areas. You know, it's a way for us to really chip away at a lot of these things. And like I said, not all of it costs money, or at least tangible money that we can see coming out the door. So, but it's important to know that you know, these things are all very important to us, and we work on these things every day. And I just want to thank, you know, our team, the Bureau team, and all of our staff at all the work that was put into this, and not just put into this, but, you know, leading up to this, and all the work we've done over the years, and then kind of all the work we have ahead of us to kind of move the needle in this space. So thank you.
Thanks, Stephanie. We had a question in the chat from Diane asking about if our subgrantee partners will have the opportunity to make any changes in their scopes of work to go along with the new strategic plan. Shannon, do you want to talk about some of the kind of work that the program staff are doing to align all of the scopes of work right now?
For sure. Yeah, thank you, Jesse. And what Steph said is 100% true. We have the best staff in the entire world, and they work so hard to get funding out to all of you. We're not expecting perfection. I've literally said this to them. This year, 100% will be, you know, we will work with you guys where you're at. In the coming years, though, as we continue to fund organizations, we will expect increased alignment with the strategic plan as the years go on. Staff, we are tracking this on our side. So we are tracking this by strategy within the Bureau strategic plan for all of our funding sources, and we will be able to report out on that. So like this strategy, we are funding all of these things, and this is the progress that we've made on that. So those are some things to look for from us in the future. If there's something you want to change, I would highly encourage you to have those conversations with staff. It's not a huge requirement this year, but next year when you start negotiating the details of your scope, I would expect that it will be more of a conversation with our staff.
Thanks, Sharon. Lori asked that if a strategy is already happening and in the plan again, will it be safe to say that it will maintain the current levels of funding or see an increase in funding, or opposed to losing or seeing a decrease in funding?
Trying to think about what. Yeah, I think I would have to know more about the details of it to be able to answer that well. I see Steph came.
Do you want to unmute, Lori, and help us out?
Sure. I'm selfishly asking specifically about the naloxone distribution and test strip distribution strategy. I'm just wondering if we would see a maintenance of our level of funding, or if, as opposed to seeing decreases or limitations on the funding. So can we count on kind of similar levels of funding?
This is Stephanie. I think that's the $1 million question right now for all of us. I think it's a priority of ours. We know it's a priority of ours. It's, you know, it's the community telling us it's a priority. It's our overdose rates in Nevada that we know it's a priority. With the way funding is today, will be tomorrow, was a year ago, it's never our intention to decrease funding, but as we look at, you know, prioritizing everything that we need to do, I don't think that I can ever sit here and promise money, you know, for any future time. But I will say that naloxone distribution is a priority, and not just in Nevada. It's a national priority, and we see that coming down from the federal level. So I think that's what I'll say. I think as we look at increase in funding or decrease in funding, you know, the way we fund things, it doesn't always stay the same. As Shannon was mentioning earlier, naloxone might be a little different, but you know, we see shifts in how our money moves based on the things that are happening in the state, based on sustainability with Medicaid. And so funding always shifts in those kinds of ways. And so we don't ever intend to fund something forever. So we do work very closely with Medicaid and other partners to really build up systems and programs and help with sustainability long term. So but I will say, as it relates to naloxone and fentanyl test strips, it's a priority of ours, and it's a priority of the state, and it is referenced as overdose prevention as we look and really compare the efforts we do in that space to our overdose rates for Nevada.
Great. Thank you so much, Stephanie. I think that was our last question in chat. I'm going to go ahead and give everyone one last chance, if they can't type in the chat for any reason, to go ahead and ask any questions. Gonna go once, twice, 2 times. I think that's it. I'm also going to go ahead and put my contact information here in the chat. If you need a copy of the strategic plan delivered to you, or if you think of any feedback after this meeting and you want to pass it along, feel free to shoot me an email at that address. It's really our intention here to make sure that this is a living document and can be improved over the 5 years that it's scheduled for. With that, I'm going to go ahead and close this agenda item and then move over to our second public comment here. To provide public comment, go ahead and raise your hand. People making public comments will be asked to begin by stating their name for the record and to spell their last name. Does anyone have any public comments? All right, I think that's it. And I think we should be able to give you guys 25 minutes of your time back. Thank you all so much for coming to this presentation. We really do appreciate it. And we really appreciate all of your feedback and great questions today. Thanks so much.